Assalamualaikum. So today I'm going to make video on station 3 from the book Get Through MRCGP. So information given to candidates will be about Mrs. Evan, a 44-year-old mother of 3 children who was asked to see the doctor to talk about her youngest son Stephen, aged 12. She's attending without her son today. Stephen's records show normal birth and development, past medical history of asthma, on beclomethasone and salbutamol inhalers, sees the asthma nurse regularly, no concerns, good control of asthma. Other attendances at the GP have been for minor self-limiting illnesses. BMI noted to be 91st centile on last attendance. So as Mrs. Evans enters the room, she says, "I'm sorry to bother you, doctor, but I'm worried about Steven's sweat. What do you think this station is testing? Make notes or discuss your thoughts with a colleague before you read on." So plan your approach to this station. Okay. So mother comes to you for his 12 years old son Stephen, and main concern is BMI, and okay, and she is concerned about his weight. Okay. So what information will be given to simulated patient? Basic details. You are Janet Evans, Caucasian 44-year-old mother of 3 who works part-time in the local bakers. Appearance and behavior: you are overweight, well presented, and a little anxious. History: freely and alleged to doctor. You have found out through a friend whose daughter goes to the same school as your youngest son, Stephen, that he is being tested at school about his weight, with other children calling him fatty. Stephen has always been a heavy boy but has put on weight over the last year and now appears to weigh more than his 13-year-old brother. Although you do not know his exact weight, as Stephen refuses to go on the scales, um, and he can be a bit as sensitive about this. You have tried to get him to play outside more, but his brother also liked to stay in and watch TV or play on the computer, and he always looked up to and followed them. He has even stopped going out with his granddad on the long walks they used to do together. Knowledge to doctor, if especially asked, the family rarely sit down in the evenings to eat together at the kitchen table. Instead, the children and your husband eat in front of the television in the front room. You usually eat in the kitchen to get some peace and quiet. In the past, you have tried to buy more healthy foods, but the children complain that they do not like them. Despite you and your husband working, money is tight, so you often shop at a local budget store which does not sell fresh fruits or vegetables. You tend to buy the more convenient pre-prepared meals, as there is often no time to do a proper meal. Simon is doing fine academically and has always achieved above average marks at a school. Steven has a small group of friends at school but has seen less of them recently outside school. And Steven used to play table tennis regularly at the local youth center but gradually stopped going last year. Steven has not complained of any excitement, and you have not noticed any problem with his mood. He has not weighed the bed since he was toddler. Steven's asthma is well controlled by his inhaler and he regularly attends the asthma clinic nurse at the GP surgery. Apart from this asthma and weight, you have no other health concerns regarding Steven. Lunch at his school is provided by this canteen, and you give Stevens money for this, although you suspect that he goes to the chip shop instead. Most members of the family are heavy, but you only think of Steven as having a problem with his weight. You did not bring Steven today as you first just wanted to discuss things on your own with the doctor. Ideas, concerns, and expectations. You believe that Steven's problem are probably due to eating too much and not doing enough exercise, but you are also worried that as a steroid inhaler may be increasing his appetite. You feel a little guilty that if you give him healthier food, then he would probably not be overweight. You think that tracking him to Weight Watchers might be a way forward, but want to know what the doctor thinks about this. Is he too young? And you are hoping that the doctor will be able to allay your fears about any serious cause of the weight and to suggest some ways to tackle it. First words as spoken to doctor. I'm sorry to bother you, doctor, but I'm worried about Steven's weight. Medical history. You have been on antidepressants for 8 months, but your mood has been good for some time now, and you are planning to see the doctor about coming off the medication. Drug history, you take fluoxetine 20 mg once a day for depression. Social history, you live with your husband and 3 children in a council house. You and your husband drink the occasional glass of wine or beer. Neither of you smokes, and you work 4 days a week from 10 a.m. to 4 p.m. at the local bakers and often bring baked and sold cakes from work. Your husband works as a roofer. You have a strong marriage. You do all the cooking for the family. Your 3 sons, Michael 15, James 13, and Stephen 12, get on well together. You drive them the 2 miles to and from school every day. You rarely do physical activities such as swimming or going on walks as a family. Family history, there are no major health problems in the immediate family. Having read the information given to the simulated patient, what do you know? You know now think this station is testing and make notes or discuss your thoughts with a colleague before you turn the page. Okay, review your approach on this station. So tested at this station dealing with a third party because son is at home. History, taking skills, health promotion and lifestyle advice, reaching a shared management plan. Okay, so domain one, interpersonal skill, dealing with a third party. There are always difficulties in conducting a consultation about the person who is not actually present. In fact, your primary role is often to address the third party's concerns, usually a relative or spouse, rather than dealing with a missing person's problem. Particular issues to consider in this case include he wants to worried about his son's weight and that he is being called names at his school, but you do not know to what extent Stephen is particularly bothered by this. You could explore this with her, and Mrs. Evans appears anxious as you discuss her concerns regarding her son. You need to address and, if possible, allay her anxieties. And do you detect any feelings of personal responsibility or guilt for Stephen's weight gain? You could positively reinforce her attendance today by saying how she is made the first step to try to help Stephen. And domain two is data gathering, technical and assessment skills, history taking skills, like you need to try to obtain from Stephen's mother as a comprehensive history as you can about his weight gain. When did she first notice a problem with his weight? How much physical exercise does Stephen do? Any sports? Does the family ever do activities together, such as swimming or walks? What sort of food does Stephen eat? Does he eat foods with high sugars and fat content? Does he eat food rich in salt? How often does he eat fresh fruits and vegetables? Where does he eat meals? And do you ever find evidence of Stephen's eating secretively? How is he getting on at his school? Has he mentioned the name calling? Any concerns raised by his teachers? Does he have any educational or learning difficulties? Does Mrs. Evan has any worries about his mood? What are her beliefs about eating, activity, and weight? What is the whole family's lifestyle like? Is it even behavior any different from that of his siblings? What does your husband think about Stephen's weight? What are his views about the family's lifestyle? What are the other children's views? Although Stephen is not actually present, have you managed to exclude any obvious scenarios pathology from taking history from his mother? For example, you could ask about symptoms such as headache and visual disturbance, thirst and polyuria, constipation and fatigue, early onset puberty, stress and central obesity, family history of endocrine disorders. Okay, and domain three is clinical management skills, health promotion and lifestyle advice. It is important that parents take some responsibility for lifestyle factors in the home, such as diet and eating behavior. If change is to happen, points to discuss with Mrs. Evans could include how willing are the family to change their lifestyle without a positive attitude to change. It is unlikely that any modification will be sustainable. Multiple component interventions are the most effective at tackling obesity. In other words, it is important to address a whole range of unhealthy behaviors rather than focus just on unsteady diet. Okay, and increase physical activity aim for a total of 60 minutes of moderate activity each day. Are there any sports that Steven enjoys but has not done for a while? How might he be encouraged to take these up again? Reduce physical inactivity aim for a limit on the time spent playing computer games or watching TV each day. Improve eating behavior such as eating together as a family at a table, healthy eating, best meals on starchy foods such as potatoes, rice, pasta, and bread, and aim for the 5 portion of fruits or vegetables each day. Look to cut down on high fat and high sugar foods and drink. Behavior changes strategies such as setting, phrase and rewards, and self monitoring can all help. And has Mrs. Evans tried any of these with Steven? What are the barriers to Mrs. Evans and her family adopting a healthier lifestyle? Example: cost, availability of facilities such as local leisure center, and other family members' attitudes. How might these be overcome? Adopting a healthier lifestyle could help the whole family in the long term by reducing the risk of heart problem, arthritis, and diabetes. So, reaching a shared management plan overlap with domain 1. For any plan to be effective, you need to make sure that you have taken into account the patient's needs and preferences. In this case, you need to think about the whole family's behavior changes is unlikely to be effective unless it is a joint endeavor. Options you could suggest to Mrs. Evan are way forward include the following: asking Stevens to come in to see you for a chat to allow you to conduct a proper assessment, including taking baseline weight and height reading. You need to feel happy that there is no other pathology causing his weight gain. Speaking to Stephen on his own could reveal his thoughts and feeling about his weight, and these need to be incorporated into any management strategy. Lifestyle changes for Stephen and the whole family in small, manageable, and realistic steps might include walking to school rather than taking the car. Does Miss Evans think this is feasible? Organizing regular family activities such as going swimming or walk with a granddad. Are there any activities the whole family enjoys that involve some physical exertion? Agreeing a limited time is spent on the computer each day. Would this be enforceable? Giving Steven and his brother a packed lunch rather than money that can be spent on unhealthy food. How would the children react? The family agreeing to eat the evening meal together at the kitchen table. What will the family think about this? Missy was not bringing home unsold cakes from her work at the baker's. Um, a referral to see a dietitian for further advice and support, such as with meal planning and shopping. A self-help commercial weight management program should be considered only if they are based on a balanced diet, encourage exercise, and do not promise excessive weight loss. Ms. Evans may wish to try simple strategies to help improve Steven's lifestyle first. Okay, so here is a knowledge base. So, a determine degree of overweight or obesity. Use clinical judgment to decide when to measure weight and height. Use BMI relate to UK 1990 BMI charts to give age and gender specific information. Do not use waist circumference routinely. However, it can give information on risk of long-term health problems. Okay, and discuss with the child and family. Okay, and after that, consider intervention or assessment. Consider tailored clinical intervention if BMI at 91st centile or above. Consider assessing for comorbidities if BMI at 98th centile or above. Okay, and assess lifestyle comorbidities and willingness to change, including presenting symptoms and underlying causes of overweight or obesity, willingness to change, risk factors and comorbidities such as hypertension, hyperinsulinemia, and dyslipidemia, type 2 diabetes, psychosocial dysfunction, exacerbation of asthma, psychosocial distress, low self-esteem, bullying, family history of overweight, obesity and comorbidities, lifestyle, diet and physical activities, environment, social and family factors, growth and pubertal status. Okay, and then management and consider referral to especially if the child has so management offer a multi-component intervention to encourage increased physical activity, improved eating behavior, healthy eating, and referral to specialists for significant comorbidity or complex needs such as learning or educational difficulties. Okay, surgery or appetite suppressant medication is not recommended for children. Okay, so take home message: taking a history from a third party can be problematic. Encourage the patient to attend for proper assessment. Being positive and encouraging a change in the whole family is important when trying to help support healthy lifestyle choices for patients. Interventions for obesity are more likely to be effective if they are multi-component, that is address diet, eating behavior and physical activity together. Okay, and task rerun the scenario with Ms. Evans reluctantly attending, having received a letter from the National Child Measurement Program highlighting concerns about Steven's weight. Rerun the scenario with Ms. Evans inquiring about whether only state can be prescribed for Steven. Rerun the scenario changing the family's ethnicity from white European to South Asian and tailoring dietary advice accordingly. Okay, so 1 minute explanation for patient. Explain why BMI is used as a measure of obesity. Explain the mode of action and prescribing guidelines for all listed and describe the long-term health impact of being overweight. Okay, and ideas for further revision. The clinical skill assessment is unlikely to use child and simulated patients. In order to cover pediatric cases, you will therefore be presented with third parties. Example of worried parent attending on their own or telephoning for advice. Think about how these scenarios might be set up. Example, a telephone consultation about a child at home with diarrhea, or parental concern about self-harm, a drug misuse, or an eating disorder in their adolescent son or daughter.